Happy New Year. 2025 is going to be a great year, not only for everybody, but particularly for our seniors, our retired citizens, the older persons in Nigeria particularly. As you all know, I'm all about the care of older persons because, as many of us know, if we're going to live long, we're going to get old one day. So this short story is just something that I wanted to use to get you thinking. Grandpa, I call him Grandpa J, a widow at age 80, had a stroke and could no longer remember or recall, his children, familiar people, loved ones. Mental and physical health were just going down. No longer able to take care of himself. Grandpa could barely stand on his feet. In fact, he was bedridden. Stroke had taken a toll on his well-being. And this one fateful day, in my usual care, I'm looking about for older persons I can help. I just knocked. Is someone home? It was a blazing sunny day with the humidity hitting the roof. Grandpa J was helplessly and hopelessly locked up in a room with no one to offer help. Room was stinking, stench from stale food, urine and stool. It was a sad story, it was a sad scene. It was really a nightmare. And make no mistake, Grandpa's home was once a place where everybody rallied and gathered, especially during festive seasons. I still remember Grandpa's home being a place every early morning, the old and the young gathered to get care. Malarial injection, if anybody is coughing. This was the normal routine before he stepped on his bicycle to go and do his teaching. This grandpa brought so many colors to the village. Many people who are proud to be graduates today, who are proud to be certificate holders, who are proud to be professionals, got their inspiration to return back to school or to continue schooling from this grandpa. But where are they now? Everybody's gone, seeking for greener pastures. But do I blame them? That's what I did, and that's what I am still doing. But without forgetting that so many grandpas, so many grandmas are left at home. People are not less humans because they are old, because they are sick, because they are weak, frail, poor, and retired. Older persons want to be seen. They want to be heard. They want to be respected and honored. I've seen so many examples of Grandpa J and in my community. And I recall one older woman also years ago. As I was doing one of my community visits, I encountered this lady and this woman. She was crawling on the floor where her own fecal waste, all the stool. She was literally crawling and all her body was soiled with stool. It was a scene I'll never forget. These are more examples of elderly neglect, abuse, and abandonment that many of our seniors in many developed and developing countries, particularly of the world, are facing. And I see this a lot in many corners of our nation, Nigeria. Elderly abuse can be psychological or emotional, which is actually the worst. As I have been taking care of old people in various parts of the country, in various parts of Nigeria, it's very sad to see the priority shifting, where the money is not really the problem, but the attitude is that old people deserve to die. Old people are distracting us, and therefore investment should be not directed to their care. They suffer not just financial neglect, they suffer abandonment, emotional abuse. Some children, some of us try to actually go back and oppress them. They are very traumatized because they feel like they have not provided to the society. Their relevance is brought to the ground. They're always being critiqued and criticized, and feel that they deserve to be punished because they didn't meet up to our expectation. But are we perfect? Are we the best of parents or guardians? One day we're going to be left in the care of people, even strangers. That's not an excuse for elderly abuse. So let me give you a clue of what they go through. Absentee children and relatives, no contact, no calls, no visit, no prepared food of choice, and no assistance with feeding. Unkempt, unclean clothing, and no help with bathing. Lack of company to talk to. Loneliness is a big thing. Lack of social connectedness. That's what is called in public health. That is what is killing our seniors. No hygiene or mobility accessories. No medicine. Even when they are sent to the hospitals, the health system treats them as, he's 80-something, she's 90-something. Why did you bring him there? Why did you bring her here? I experienced this taking care of my late father. I experienced it taking care of many loved ones. It's like once people reach a certain age, they deserve to die, not knowing that there's an experience and wisdom we get from the older people, that we can never get from the young. And if you give them extra 1 year of quality life, it's really worth every investment. They suffer no hygiene. They are unclean. Their home is unsafe. They fall. That's a big thing with the older people. Leaking roof, no lighting. They're unable to pay their rent. Open sores, falls, untreated wounds, sickness or injuries. They're so sad. They're so depressed. And they are not just bedbound, they're floor-bound. Some of them fall for days before they're discovered. That is not how God created us. So what am I saying? The list is endless. And that's why we're here. Age with Grace Health Services, we're here. We're here to go to where these older people are. We don't want them to even come to us. We want to go to their homes. We're there to take care of them. So as we continue this year, you're going to be hearing from us some information. For those who cannot get to your home, we can get to your home through this forum, where we provide you tips on how to support older persons in your circle, in your network. So stay tuned as we bring some series this year on how to help you support older people in your family. And you can go to our website and get some information from us at awighealth.com. You will get some information and you can reach us. So stay tuned.